right before the pandemic really hit, particularly in the United States, the Center for High Impact Philanthropy, in an effort led by our colleague at Mindful Philanthropy now, Kristen, answered the question or tried to provide great evidence-based, actionable answers to the question, how can philanthropy better address mental health and addiction? Health in Mind, which is our publicly available free guidance on our website, answers that question by outlining the key evidence-based strategies on how to help, as well as examples of nonprofits that are doing that great work every day, particularly around the country here in the United States. That guidance was publicly released at the Kennedy Caucus Room in February 2020. And who would have known at that time how much our world would change? That change and the way this global pandemic has affected everybody prompted us to revisit that original guidance and understand how can donors help given the far-reaching effects of COVID-19 on mental health and addiction, which the result of which was those who were already vulnerable were made that much more vulnerable. And those who might not have been at risk found themselves now at risk of mental health and addiction challenges. And so what you're seeing on the screen now are the 4 high-level strategies or ways that philanthropic funding can help some of the most urgent behavioral health needs brought on by the pandemic. Number 1, responding to the disruption in education from early childhood all the way to post-secondary. The second was to address what are now well-documented racial disparities that have been laid bare by the pandemic. The third is to help those who are newly vulnerable or whose risk of experiencing mental health and addiction challenges significantly increased due to COVID-19. And then, one of the silver linings is a greater appreciation of the need to address mental health and addiction for all. And so expanding access to what we already know works so that more people are able to have their needs met with the tools that are already available, but unfortunately are not reaching nearly as many people as they could. So with that, I'm going to ask Kelly, thank you, to close the slide. And for those of you, what I suggest, partly because it'll help you engage with our panelists, is on Zoom, I would just highlight the people who are the panelists who are on video. Everybody, please, if you could mute your microphones. And know that we are in webinar mode, which means if you look at the bottom of your screen, there is a Q&A function, right? So I welcome everybody to use that Q&A function throughout the course of the webinar, and know that about 20 minutes before the hour, I will start picking up the questions and asking them of our panelists. I will also keep an eye on them throughout, because it may be that something that one of our great panelists says prompts a comment or a question from you. And if it's right on point, I am happy to weave that into the discussion. Okay. So with that very long windup, let's go ahead and get started. And my first question is to Kristen at Mindful Philanthropy, particularly because of Mindful Philanthropy's work in convening and educating and engaging donors who are interested in or already deeply committed to addressing mental health and addiction. You've seen new funders coming into the space. You've seen existing funders reinforce their commitments. May is Mental Health Awareness Month. So as we come to the end of this month, what are some of the major trends you're seeing in engagement from across that diverse group of funders that you're working with?
Thanks, Kat, and thank you for having me and coming together with Mindful Philanthropy to co-host this important conversation. I think what's exciting, and you mentioned a silver lining, is that all eyes have been on mental health this month and throughout the pandemic. And I think as unlike ever before, we've experienced mental health so much more intimately over these last 14 months. And as a result, more funders are coming to the table, from big corporations to professional sports teams and influential figures. But as they do that, I think that there's a cautious optimism to kind of how much attention and funding might follow that attention. But initially, what we're seeing is that a lot of funders are coming to the table thinking about emotional well-being and youth mental health as a potential entry point for supporting mental health. Kind of starting in the shallow end of the pool, perhaps, and in thinking about the connections between mental health and other issue areas that they might be better versed in giving to, for example, education. And then as we've seen over the last year, and today is the 1 year anniversary of the death of George Floyd, the issues related to people of color and Black, Indigenous populations, and the experience of trauma, and how the need for support at the community level that does not highlight race and trauma in itself, but really gives communities the support that they need to be healthy, to be well, and to live holistic lives, is a really important trend that we're seeing more attention and hopefully also more funding come to. There's so many others, but I think that those are two good ones to start with.
That's great. And we can certainly pick up some of those themes of how to integrate great solutions across some of the silos that have existed. I want to turn to Karen and FORE, so the Foundation for Opioid Response. We've seen COVID's significant impact on the opioid crisis and overdoses. And FORE is a fairly new foundation. So it was launched to support solutions to the opioid epidemic, with its first grant cycle awarded during the early stages of this pandemic. So I can only imagine the kind of flexibility and just nimbleness that you needed, and you and your team needed in order to respond. So can you tell us more about what this grant making process was like, and how FORE is supporting people with addiction during this challenging time?
Right, Kat, thanks so much, and thanks for including me in the discussion. So, as you said, yes, January, February of 2020, we were just getting ready to make our first grant awards, and today we have 43 grantees and active projects. So it's been a very active and robust year in terms of grant making. Last March, early in March, we announced our first 19 projects based on an access to treatment for vulnerable populations RFP that we had opened a few months before that. We announced it basically the same day that New York City, our foundation's based in New York City, basically the same day the city went into full lockdown. And so all the other initial program plans that we had laid out for 2020 obviously were put to the side. And one of the first things we did was immediately use our brand new network of grantees to find out what was happening on the ground. And in essence, they really became our eyes and ears. Clearly, as we couldn't travel, we couldn't continue to learn in the way we had been learning. And we needed to, and we asked them, what were they most worried about? How were they going to think about maintaining continuity of care for their patients who were in the midst of opioid use disorder treatment? What were they hearing from their patients about their worries? How were they going to deliver care safely? And what do the public health emergency requirements mean for their access to treatment programs? These and many other discussions led us to a 4-part strategy in terms as our COVID response. The first was to very quickly launch a series of webinars, weekly webinars, to bring expertise together to answer some of the questions we were hearing from our grantees. Webinars was something that I imagined as a foundation we would get to in year 3 or 4, not year 1.5, but we did it, and we started putting out a number of resources, issue briefs, technical assistance documents as part of that. Our board was very concerned that we check in with our grantees in terms of, was there anything else they needed to make sure they could stay up and running and carry out the projects that we had funded them for. But we were also hearing that there was a real gap in terms of recovery services, which are so often delivered in person, group meetings, one-on-one interactions with peers. And so we developed a small RFP, small grants, rapid turnaround, very different than our first RFP, to get some small funds out there to help those programs maintain access to care. And finally, the fourth part of the prong was that we also recognized this was going to be an important period for learning as well, and hopefully to inform longer term improvement in access to treatment for OUD. So we began to develop a portfolio of projects in health services research to make sure we were learning from temporary changes during the pandemic, such as use of telehealth, use of extended take-home doses for methadone, for example, which we now hope, as that information now comes out, we're now thinking about how we feed that into policy. So I'll stop there for a moment.
Well, I guess, so that's a lot for a new foundation. I'm also struck, the center works on all sorts of issues, and a lot of what you described are some of the best practices in crisis grant making, right? Immediately go to those on the front lines because they are closest to understanding what the needs are, move money quickly, try to eliminate some of the barriers to grant making so that the money can get in, where it needs to. So great. Thank you for that. I want to turn now to Erica with the Colorado Health Foundation. And we know at CHIP that you have a 3-pronged approach for supporting the mental health of youth, and that includes nurturing healthy minds during early childhood development through social emotional learning, youth resiliency during adolescence, and then young adult recovery. As we begin to deal with learning loss and the mental health impacts of social distancing on children, how should we consider our grant making to address these issues?
Thanks, Kat. Appreciate the opportunity to participate on this panel. And as a mom of an 11-year-old struggling with the impacts of the pandemic, this issue is both personal and professional. But I have so much to say on this, so I'll just start with a few points. Just in thinking about the impacts of the pandemic and the future of grant making, I would really encourage grant makers and donors to think creatively about how to support our youth. And by creatively, I mean looking at the innovations that help create connections, build empathy, both in person and via technology. We know there's a boom in the field right now with virtual reality that focuses on social emotional skill building. And we know that many of our youth respond really well to technology, although we know there's also a need to find a healthy balance and the importance of the peer-to-peer connections. So, we've been thinking a lot about how to support the transitions back to schools and activities, and really recognizing that for some, these will be difficult and there will be needed an extra support. So how do we equip those environments and those caregivers with the supports they need in helping with those transitions? I'd also encourage funders to think about how they influence policy and the federal and state dollars that support mental health. We know there's a lot coming into states right now, so there's a real opportunity for us to use our influence and voice in supporting youth beyond just our grant making dollars. And finally, I think we hold so much privilege in the field of philanthropy. And so I think there's an opportunity for us to keep the spotlight and funding fixed on the disparities rooted in racism and socioeconomics and the conditions that prolong them. We know they contribute to the loss of mental health. So I think it's important for funders to think about the intersections between these as we fund and continue to fund mental health.
Great, thank you, Erica. And in a way, you're ending on that note about keeping in mind the privilege and the disparities is a very nice segue for the question that I wanted to ask Octavio to bring him into this conversation. Because we know that the pandemic's impacts have not been felt equally. Black and Latinx communities in particular have experienced disproportionate rates of death, hospitalization, and unemployment as a result of COVID-19. Octavio, can you discuss how the Hogg Foundation is addressing these disparities? And we'd love your thoughts on how philanthropy can help center equity in grant making for mental health.
Thank you, Kat, for that question. That's going to take a little bit of time to really dive into. But let me also tip my hat to my colleague, Erica, because I'm also the dad of an 11-year-old, and to all the parents out there, it has been an extraordinary year, right? But getting back to your question, Ken, also thanks Chip and Mindful Philanthropy for bringing us together. This is really, really great to see my colleagues here. But one of the things, obviously last year that became very clear to all of us, and it played out across our TV sets, the radio, social media, was not only the impact that was happening on our communities of color, especially when you took our Black community, Hispanic Latino community, Native American community, and now later on with the xenophobia as it impacted American Asian Pacific Islander community. So no one was left untouched. And of course, the pandemic, because of that, is touching everyone's life. But it really just highlighted the inequities and the disparities that unfortunately existed prior to COVID-19. The pandemic took advantage of that and really just highlighted how fragmented our healthcare system is and how much we really need to work on when it comes to, it's already been mentioned, the social determinants and also racism and its impact, really some of the root causes that impact some of these. And then there was the social justice movement. So in fact, if you haven't heard of the term, and I hope you have, is syndemic is what we're actually dealing with, where you have actually multiple issues, healthcare and political coming at the same time, impacting our communities. And that's what our communities of colors are dealing with, folks, is the syndemic. And the Hogg Foundation recognized that. So one of the things that we did this really to challenge ourselves, but we also wanted to be transparent and to show really our community and our grantees in the state of Texas and the nation how important this was. And so we stood up a declaration that racism is not only a public health crisis, it is a mental health crisis. Because one thing I had noticed, and we weren't the first, obviously, there was declarations already coming out by great organizations like American Public Health Association and other cities, counties. But no one was talking about the mental health crisis, which we already had that existed. And it really felt that it was important. For those of us in the behavioral field, we know that we have been dealing with stigma and as an afterthought for way too long. And there is no health without mental health. And another way to really convey that concept was to put out that declaration. We've had over 180 organizations, Kat, that have signed on throughout the United States, which is a testament, I think, to others were thinking definitely about this as well. But, it's not just about the words or the declaration. That's just a simple first step in a long journey that we must all take. It must be followed with action. And in that, we laid out actions that the Hogg Foundation was going to do. And one of them was to work on establishing an Office of Health Equity for the state of Texas. And to start to do that process, and it's already been mentioned, the importance of policy, I think, by Kristen, and we do policy work at the Hogg Foundation, is then starting to get the word out of why it's important, like writing an op-ed piece and really showing the need to improve our data infrastructure and develop the metrics that are necessary to really, and it's not just about race and ethnicity anymore. We're not even doing that well, but we've got to go beyond that now and start to include language and also the data that reflects what are the social determinants that are impacting our communities of color. So those are things that I think other foundations can definitely do as well. But let me stop there because it's very rich and there's a lot to discuss. And I want to make sure that we get to a lot of these other topics that have already been brought up.
Terrific. Well, great start. and hopefully for everybody, this conversation is the start of a conversation that will continue long beyond, right, the hour that we have together. It can feel overwhelming, right? There's been a lot about that sense of overwhelm that everybody has. And yet we also know that crisis can bring people together in ways and can prompt collaborations, can prompt new thinking, that expression, never waste a good crisis. So I'm curious, what are some of the silver linings that you've seen, or good progress that if it weren't for the crisis might not have happened as quickly? Maybe start with some of the good stuff, and maybe that'll help us think about how we have the fortitude to tackle some of the ongoing and longer work that we need to. Anything that stands out for you as a silver lining of this time? Karen, go ahead, please.
I can start and sort of pick up where I left off in terms of some of the health services research projects. So because of the public health emergency, as we know, there's much more flexibility around the use of telehealth services, including to start people on buprenorphine as part of medication-assisted treatment. Also more flexibility given to the opioid treatment programs and the methadone programs, so that patients didn't have to go to clinic every day or every other day. If they were stable, they could receive an extended take-home dose of medication. These are the sorts of flexibilities to improve access and reduce barriers to treatment for OUD that many people in the field have been advocating for many years, right? And then suddenly this has been an opportunity essentially to test those out. We are fortunate to support a number of really exciting research, health services researchers and clinicians around the country who are trying to answer some of the questions around what is the impact on access, what is the impact on patient outcomes, but also on the providers. Are these new models sustainable? And if they are, and who are they working for and who are they not working for? We hear rural grantees that this is great. Now my patients never miss a visit. And we've heard from some of our grantees in more urban settings or who are trying to serve a homeless population that clearly this doesn't work. That's not going to be the answer for them. So it's a tremendous opportunity just to capture as much learning as we can. And then as Erica and Octavio said, really then feed that into policy discussions in this next phase.
Octavio.
Trying to unmute, guys. Just want to reiterate, Karen's right on about telemedicine, telepsychiatry. We've been working so hard to try to expand that and to ensure also, parity, that the payment level should be the same. So to the policy point, there's lots of work still to be done, but it showed that in short order, we can be flexible and stand up these innovations and take them to scale. And yet we've been dragging our feet because of the status quo, because of vested interest. But the other thing I wanted to expand upon is just also the use of technology in general, how it's really been so beneficial, not just the tele stuff, but even the use of the old-fashioned telephone has really made a big difference for some communities and members that are trying to have access, as well as the apps that are now being developed hand over fist that we need to that are coming out that I think can be all beneficial. The one caveat I should have though is we need to be looking at all of this technological advancement, great stuff, but it's also highlighting our digital divide. Because in rural areas here in Texas, I can give an example, they didn't have the broadband, so they weren't able to take advantage of some of these wonderful, flexibilities and relaxation of rules that happened. And so they were still left out of the picture. And that also, we have to be very true as have that health equity lens and ensure that we're not creating additional, disparities. So that's not to say the advancements we made and how wonderful this approach has been, because it truly has been. And then I'll just end with this, Kat, which is, and I mentioned it in my opening remarks, really that we must take the opportunity that all of us have been educated to a certain extent. Maybe the terminology is not the same, but the understanding that there's our disparities out there, and that and different communities have been impacted differently. Because for a long time, we've been working on just to educate our general pop on these very concepts. And now they played out across the field. And those are the relationships we know that are multi-systemic. Like, why is, a disparity so important? Why are they talking about racism? These are opportunities for us to take advantage of in philanthropy that I think no other sector can do what we can do.
It's interesting too, when you ask the question, where are there disparities, well documented around the racial issues, but also what are the barriers prevent access, including things like the digital divide, as you just described. Erica, you've had your hand raised. Join us.
Yes, and I'll just kind of add on to what both Karen and Octavio shared. And yeah, the digital divide is a very real thing in Colorado. We have many rural and frontier communities. And so for us, what we recognized is we had to think differently. So we have been funding and supporting broadband access, because we realized it was so critical, because as we were seeing the advancements in telehealth and opportunities to reach youth in ways that we haven't been able to before, we also thought we needed to look at broadband as one of our funding strategies. But the other places that I don't think have been mentioned that I'd highlight as potential silver linings is just the level of collaboration related to mental health. We've seen kind of mental health is part of the discussion in schools and all sorts of employment places, and including our funding community, about how do we increase that for employees. We've seen just primary care, behavioral health, housing, and food kind of come together. And I love what you said. I think you called it a syndemic, Octavio. That really resonates. But I just think the level of collaboration and discussion that has resulted is been wonderful, and something we've just been thinking about. How do we continue that dialogue among those partners? And then finally, and I'm hopeful in that it's a reduction in stigma related to mental health, a recognition that we need to be holistic when we think about health, and it needs to be incorporated along, with physical health and oral health. And, we need to think about it in our places of employment, in our schools, et cetera. And so we just hear more and more people talking about mental health, and that gives me hope. It gives me hope that we have a reduction in stigma.
Terrific. Kristen.
Yes, I'll jump in with a last word. I think while we talk about kind of the innovation and the speed of that innovation and the opportunities to break down barriers that have been preventing access to care for so many years that quickly were kind of eliminated by force, by requirement as a result of COVID, I think that innovation has also been paired with somewhat of a back to basics approach, and thinking about some of the really unsophisticated or simpler, kind of briefer, low-level interventions and prevention opportunities that are available in communities, and really emphasizing community-based care, community-based prevention, and supporting communities, whether that be through federal funding of certified community-based behavioral health centers, or supporting barbers to provide better kind of first-line access to care. I think that the pandemic has really forced us to think at that top-down and bottom-up level to reinforce the infrastructure and ability for communities to care for themselves, and to allow trusted community members and credible messengers to have the resources and knowledge and education that they need to be able to support their neighbors. And I think that that's something that we really need to emphasize and continue moving forward as we kind of get back into the flux of the new normal or regular post-pandemic life.
That's great, Kristen, and a great reminder that philanthropy can and always has been available to fund both the top down and the bottom up. And, it reminds me, I had a question for Octavio earlier, which is to how do we center this in center equity? And I think you're reminding us, and we need to center it in communities. Octavio, did you have a?
Yeah, one more comment. I mean, this is such a great discussion. I totally agree with everything my colleagues have said. This is just really fabulous. But it made me think of, like Kristen said, made me think of something else, which is, I think this is also highlighted not only the importance of mental health, and it affects us all, but really that interface between physical health and mental health, and even our spirituality, which is that we need to have really much more holistic, collaborative approaches. And so there is already the collaborative model out there, and Kristen kind of mentioned one of them, and how we've now seen how important truly is that we need to be taking care of ourselves completely, holistically, and also that should be the kind of healthcare system and that we should be having access to. I think if there's anything that can highlight this more, has been this pandemic. And if you think about also the impact of the virus, and especially on those that they're now calling the long haulers or the post-acute sequelae of SARS-CoV-2, how that is so physically tied, but also to one's mental health, because now you're going to have folks that unfortunately came down with the virus that have ongoing infection. And a chronic illness, we know, is a high risk indicator for having an anxiety or depression or another mental health event. And so this is really highlighted how important it really is to continue the transformation of this healthcare system that we have here in the US. So thank you for letting me weigh in on that.
Great. Well, I mean, you're each starting to paint a picture of what can be a new, better normal. And I want to, and you've also all mentioned policy and the importance of good policy to reinforce everything that you just said. So, in March, Congress passed a historic COVID-19 relief package that builds on the initial investment for the 2020 CARES Act. And it's to include $4.25 billion in funding towards mental health and substance use disorder treatment and services. With that context, I'd love for you each to talk about what are the opportunities for philanthropy to have an impact with this unprecedented scale of federal funding, and maybe talk about other policies that could help us accelerate progress.
I'll just jump in really quickly and steal one of your lines, Kat, really, because I think that when there are large philanthropic, or there's large federal funding or large business funding or other levels of funding that are more restricted, more time bound, philanthropy has a unique role to play. And philanthropy can fill in those gaps. It can understand from a restriction standpoint or a time standpoint, what are those gaps, and whether it be in providing knowledge and guidance that maybe a state or a locality or schools even don't have to be able to disseminate that funding, in the case of the American Rescue Plan, and talking about schools and education and investments in social and emotional learning. They can also think about kind of what is the tail end of that federal funding, and what do we anticipate the needs being as that funding comes to a close, and where can philanthropy provide resources now or provide capacity building support now, so that when that federal funding ends, that there is not a cliff, that it's not kind of a drop off and then we're back to square one.
Just to follow up on Christian's comments, absolutely agree. We've seen from previous rounds of money that's with funds that were focused on the opioid response, specifically that many states struggled to spend the money when it got to the states. They either didn't have the capacity at the state level to get the dollars out, or or they didn't necessarily know where the most effective, where the programs were that would be most effective and impactful. So I think philanthropy's ability to support pilot programs, to do the evaluations, and then to provide that information the results of those projects in ways that can be picked up by state leadership, local county leadership, as well as to federal policymakers is a really important ongoing role for philanthropy. And then I think, our perspective and our ability to have a really broad perspective and an understanding of what we were talking about before in terms of the intersectionality of all of these components of the social determinants of the impact of trauma, including racism, of the need to bring physical health, behavioral health, mental health services together into a much more coordinated set of services for people are all perspectives that we can continually bring. We can emphasize them through our projects, but then also through our policy, through our policy lens and communication and education activities to try to broaden that so that the funds don't come in such siloed ways that that providers and service providers on the front lines can't really put together the programs the way they need to.
I would just echo my colleagues and maybe add, and I don't know if this is happening in other states, but in Colorado, there's definitely, we're fortunate that a behavioral health task force came together this past year. So that group will be instrumental in thinking about this new influx of funding. And where we've really played a role is bringing new voices and perspective to those tables. So as funders in the mental health, we think it's really important to lift up and create space at the table for individuals with lived experience in mental health and substance use, as there's so much knowledge and wisdom. And I think they can be really instrumental in thinking about how do we use these funds effectively. So I think that's a great way philanthropy can play a role. And then also, I think what we've been thinking about is we have a lot of dollars in the field in these organizations. So how can we be more flexible? Sometimes that's harder to do with state and federal funding. And so as a private philanthropy, can we be more flexible with our partners and how they use our funds to really think, have the long view about, how these funds can be effective and have change.
Yes, Octavio.
I'll just add to what my colleagues have said that are, to me, just spot on, is one other thing that we do in philanthropy, we do it quite well, is convening to ensure that we're bringing the right parties to the table, the right stakeholders, and to the point of including the community voice. That we can do. We can ensure and force some of our policymakers and our governmental, entities and representatives to be able to really hear the voice of the people. We can do that with the convening, but also ensuring true collaboration is working. We have that ability, and it is really important, especially when you take into consideration everything that has just been laid out by my colleagues, to ensure that we're having effective, impact when we're coming together.
Terrific. I mean, in many ways, you've all outlined some of the unique strengths of philanthropy, right? The convening power it can have, the increased flexibility, particularly compared to government funding. We have, so thank you for folks who are already putting questions in. I'm going to transition us into more of, as much as I have a gazillion questions I could ask folks, I want to give those who are in our audience time to ask questions. And I'm going to stick a little bit still on the federal funding because there's a question that came in. So please, folks, put your questions in the Q&A. But the observation that federal funding is not nearly enough, as big as those numbers seem. What reforms are happening to enforce two things that folks have already mentioned? Parity, so to make sure that services are covered for mental health and addiction at the same financial levels that they are covered for other health issues. And what reforms are happening to enforce evidence-based practices. So parity and evidence-based practices, are there initiatives or policy reforms that any of you are aware of that are working on those two issues, parity and evidence-based practices?
Kat, I'll just mention in reference to parity, I am hearing discussions, and one of them is at the very highest level in the federal government. I was chosen by President Biden to be on the Health Equity Task Force. Just want to let everyone know, our participants here, those discussions are happening at that level. So it's part of the recommendations too that'll be included in will go to the president. The good thing is that the discussions are also happening, or the flow of information, let me say, in real time is happening through our chair, Dr. Marcella Nunez-Smith, who's also on the COVID-19 White House, committee. So what's happening with the task force gets conveyed in real time to the committee and to the president and to the vice president. Hence the reason that you're seeing some of these new initiatives and executive orders. It's already incorporating some of the dialogue and recommendations coming out of the task force. But the parity specifically, that has been brought up. And what I will point out, and where philanthropy does have a real role here, is that there's the federal, because it's already been on the books for quite a while. But also you can be working at your state level to ensure that, say, your Department of Insurance is actually on notice. And we have great standing in our communities. Those of us that are regional or even our nationals, if you go and want to meet with, the director of finance or insurance for your state to talk about parity, you're going to put it on their radar, or your health and human services representative or commission, whoever you have in your respective states. My point being is, some things we don't need new laws. What we need to do is enforce what we already have on the books. And parity is definitely one of them. And we haven't been holding people's feet to the fire. So to, specific initiatives that are going out there, I know that there's discussion happening here in Texas. We have the 87th Texas legislature going on, that stakeholders are bringing to the attention of our legislature. And then just wanted to add, and we're also having and making those recommendations also from the task force to the president. So if everyone were doing that, maybe we can finally get the parity law to finally have the impact that it was intended to have, because it would make such an amazing difference, because too many of our community members are still having to fight this on their own and feel unsupported, when in fact that shouldn't be the case.
Yeah, and I thank you, Octavio, for highlighting kind of that local and state opportunities, because I think that sometimes we forget that so much of policy is driven at the state and local level. And while parity is, of course, a combination of enforcement at the federal level and the local level, and partnering with insurance companies to really get them involved and to have some skin in the game to ensure that they follow this law that has been around for over 10 years now. And when we were launching Health in Mind on the Hill last year, it was around the same time that the Milliman report came out rating states on parity. So it seems a little bit like a never-ending battle, but I think that it's really at the state level where there are opportunities. But for anyone who's interested in learning more, there is an event on Thursday, I'll drop it into the chat, being co-hosted by the Kennedy Forum and Inseparable, on ending discrimination in health insurance coverage, that I think will continue the conversation around parity.
Fantastic. And a reminder too, we are recording this. And so any resources that have been mentioned by these panelists, we will send to everybody who's participated in a follow-up message. So you'll have that handy. Another question, because you are each in a role either to make grants, or, Kristen with the Mindful Philanthropy group working alongside and supporting funders who are making gifts and grants. Could you provide examples of a particular grant or a particular organization whose work you supported, who you feel like is a good example of how nonprofits are responding well to the needs right now?
I'll start. There's so many that I'm pausing, but one that comes to mind, something we've focused on pre-COVID, but certainly have seen it expand, is peer-to-peer services, particularly in our focus on adult recovery. And we've really seen that taken off through technology. And, we've long talked about the role of libraries and some of these kind of community hubs. And so one interesting project that took off was our public libraries serving as kind of peer hubs for our teens and young adults. And, we were a little interested to see how it would play out this last year. And kind of back to the technology piece, I think the youth loved it. They embraced it. It was such a way for them to stay connected, but not in a school setting, in a very informal kind of fun. They led it. There was a leadership and an empowerment component. And so it just was, I think I should bring that up, and just that there are venues outside of our school settings that can play a role in mental health. And and I think are eager to play a role in mental health. So it's caused us to think outside the box of who those partners need to be, or who they are in terms of supporting youth and young adults.
Well, it gets to that creativity theme that you flagged early on. Yeah, Karen?
This is almost like which is your favorite child, right? So like Erica, there are so many, but to pick up on the evidence on the part of the last question around evidence-based treatment as well, and maybe tie it a little bit there. We have a grant to an emergency medicine physician at Massachusetts General Hospital, Alistair Martin. And as part of our access to treatment portfolio, he proposed to do a lot of outreach and training and engage more ED physicians in doing buprenorphine, the waiver training, so that they could initiate and start people on medication-assisted treatment when they come into the emergency room, either looking for help or after an overdose. Pre-COVID, the plan was that he would reach out and do trainings and hope to get maybe 50 to 100 people at a training, right, in different locations around the country. He quickly pivoted to doing virtual MAT waiver trainings, and instead of 50 or 100, he got 1,200 at his first waiver training. He's now done that another 3 or 4 times. I think he just did another one in California, doing them now regionally. So through that program, and then in partnership with the American College of Emergency Physicians and the California Bridge Program, they collectively have trained and engaged now thousands of ED and other clinicians around the country to at least provide them with the clinical skills and confidence to be able to initiate treatment for more people. So in terms of expanding access and reducing one of those barriers, and taking and sort of making the best out of a completely different situation than he thought he was going to have to work with. He and his colleague, Dr. Xuan Yi, have really done an incredible job.
That's a great example. Thank you. Octavio.
Let me add a couple of examples. One of them that the Hogg Foundation helped to fund, and it's really about thinking about, because some folks might ask, what does that have to do with behavioral health? But I think many of us, when we know of the intersection between systems and the social determinants, is food insecurity. So that became very prominent. So I know that many of our colleagues out there in philanthropy did the same, is funding the food banks. Made a huge difference. That's more and more of an immediate impact kind of funding, we know, but it was definitely needed and necessary in so many communities throughout the state of Texas, especially especially our rural areas as well. Separately though, being more strategic is also recognizing the impact that was happening on our providers. And so we funded the Dell Medical School to be able actually to stand up mental health services for the responders themselves. Because we think about the community as appropriately we should, but if we don't have our first responders, we're not taking care of them. And it really makes me think of the loss of that emergency room physician that happened up in New York City, and how that really hit the country so hard. But also those of us that are physicians or in the medical field, nurses, social workers, for providers, the impact it's been taking and the toll on them and their families. And I'll just add, because it's just really a sad statement for our Asian American providers. And I've heard from them personally and directly in many cases now, not only through the Hogg Foundation, but my work through the Health Equity Task Force. They're putting their life on the line for us in an emergency room, in providing vaccines or in other hospital settings. They take and they're revered there. They take their scrubs off and they're going home, and then they're actually being, either maligned verbally. In some cases, there have been physical altercations. That is just that's not the America that I recall or I think I'm working toward. And the fact that it's happening now, we all, and this is for charge to us in philanthropy, we have a role that we can really make an impact and stop this, because it is just not right. And these are full Americans. These aren't folks coming from other countries, but if they did, we should still treat them with respect. We're all human beings. But let me stop there. I'll get off my soapbox there for a second, but it's such an important event that has happened that I think we really need to pay attention to this.
Great, thank you. Thank you for that important message, Octavio. Kristen?
Yeah, I'll just end by saying I think that what's exciting is to see organizations really come to the table and think about what mental health looks like within their system, within their organization, whether they are operating in a different system or thinking about community supported mental health, and really meeting individuals where they are, whether that be in the judicial system or the workplace or schools or in the community or the healthcare system, and what mental health looks like in each of those places. So I will say, please look at the Health in Mind COVID guidance, because there are so many organizations listed there that really take a blended systems and direct service approach to incorporating mental health in areas that you might not expect. And the organizations included there might not be your obvious mental health organizations, although those organizations are doing such incredible work. But I will just highlight one organization that I think can potentially serve as a model for community-based organizations and systems to think about mental health as a part of the fabric of their work. And this is Public Allies, which is an AmeriCorps program, and they are really being thoughtful about what mental health looks like to them and how they integrate mental health within their organization, the institutional fabric, and then also supporting their employees, their members, and then the community members in which they serve by providing training, by providing ongoing supports and structural employee assistance programs or member assistance programs, and thinking very holistically about what people need to be well in the workplace, and then provide service to their community, because they're not going to be able to provide a good service if they are not well.
Thank you so much for all those really good reminders, Kristen. We are unbelievably at time. So what I'm going to do is, this is going to be a lightning round. You each have 30 seconds. One final thought you want to leave with our audience, who are all here because they're trying to understand how philanthropy can better address mental health and addiction. So you each get 30 seconds. And maybe I'll start with Kristen, who just ended. I'll go around in the circle as I see you. Parting thoughts for folks.
Any place is a good starting point. I think integrating mental health in your work, it doesn't matter where you start, just start.
Great. Erica.
I just think we have a real opportunity. There's momentum, there's energy related to mental health. And we've talked a lot, you've heard the inequities within the system. So I think philanthropy can play a critical role in disrupting the systemic racism that we know that exists within our mental health system.
Excellent. Karen.
Great, thanks. I think the two words I think about through this whole conversation are integration of services and intersectionality. So I'd really encourage everyone to, ourselves included, to think about our usual silos and where our programs begin and end, but how important is it that it is at this point, and the COVID's just really further shone a light on that we have to be able to work across sectors, across disciplines, think about food and housing as much as we think about medical treatment and recovery services.
Excellent. Octavio.
Great question, Kat. You know, to do this work, I'm going to go with health equity. Really need to have that health equity lens. But I charge us, my colleagues in philanthropy, start internally. How is your governance structure? Does it model good health equity? Is your board representative and diverse? What about your grant making process? Even just the words that we use to put on paper and we send out, does it actually put forth a health equity lens and really stand up diversity, equity, and inclusion?
All right. Great advice. Break down those silos, keep the momentum going, center with equity. And I'll end where we started with this lightning round. Kristen, just start. There's too much work for us to do to not just start. So with that, thank you. I have the best job ever, right? I get to talk to folks like you and share your perspective with others who are here because they want to help. So please join me, all of you who participated, in thanking our terrific panelists. At this point, I'll ask my colleague to put up the slide where you can see all the free guidance and the examples that we've been talking about and that Kristen mentioned. So thank you all for joining us, and have a great day.